This is a stakeholders meeting and joint visit by Deputy U.S. Chief and delegation to plan on the way forward of sustaining HIV epidemic control. And although there is no vaccine available yet, care shall be taken to sustain the treatment.
We're aware that in Abia, there are an estimated 53,000 or so people with HIV, and nearly 40,000 of them currently don't have access to life-saving ARVs.
We implore you to strengthen the supervision and implementation of HIV program in Abia State. We are talking about sustainability and ownership.
Participants were briefed of the new approach to support Abia's expanded HIV program and called on all stakeholders to actively play a role that ensures all PL-HIV are identified and placed on life-saving treatment. PEPFAR and CDC support will be provided through the implementing partner, Catholic Caritas Foundation of Nigeria, CCFN, which will focus on quality HIV clinical and program management skill building to ensure service delivery transition to the state government, while simultaneously accelerating the initiation of PL-HIV on life-saving antiretroviral therapy.
The Catholic Diocese of Umuahia, on her part, promises to continue to educate and conscientize the public to see HIV/AIDS patients not as people to be avoided and abandoned.
The search for the non-identified cases for HIV to make sure within the next 12 months to 18 months maximum, we found those missing 38,000 individuals.
Ranking as the state with the sixth highest HIV prevalence in the country, Abia State has an estimated 58,341 PL-HIV. But the U.S. is hopeful that the state government and other stakeholders will be willing to work together to close the gap in HIV treatment by identifying and initiating treatment for an additional 37,000 people living with HIV, PL-HIV, in Abia State within the next 2 years. PEPFAR supports HIV treatment for over 80% of 1.8 million Nigerians and works with state and federal government agencies to build health systems to achieve and sustain HIV epidemic control.
In Abia State, we clearly understood the challenge of the health sector from 2015. And we wanted to see how we could speak to life expectancy as an index of our efforts globally to create better health conditions for our people.
We're trying to reach 58,000 people who have HIV in Abia State that are not yet on treatment. Once we get them on treatment, we can suppress their viral loads, or they can suppress their viral loads, and then they can make it so the disease is not transmittable.
The U.S. is looking to Abia State to lead and demonstrate a model of sustainable state ownership of the HIV response. Indeed, this will help to strengthen the partnership between the United States and Abia State.